A cheerful heart is good medicine, Proverbs 17:22. Hi, this is Robin again. I wanted to tell you about my appointment today. Well, actually, I had two. The first one was my Go See, which is also known as a weekly see, where you meet with your nurse practitioner, your nutritionist, your physician assistant, and your radiology oncologist. So, starting off the appointment um, was my nutritionist said I am the poster girl for her nutrition advice, I guess, in radiology today. The fact that I have not lost any weight is awesome, and that's why I get that award. So, I saw my physician's assistant and my radiology oncologist, and I had my list of questions that I needed some help with. One was, my mouth is starting to show some signs of deterioration. And one of the things that's bothering me is the flossing, because I'm supposed to floss in the morning, floss at night. So all good children floss twice a day, right? But the gums are becoming a little bit too painful. So once I break through the two teeth with the floss, it's landing on a very sore gum. So he gave me permission to skip the process until I'm all the way on the other side and I have had a chance to heal my gums. Then I will pick it up. He also said that I could skip the fluoride trays at night, but not skip the fluoride treatment. So what he said was to actually get a second toothbrush, which I think I'm not going to do, and take my fluoride tube gel and put it on there and just kind of go over my teeth, because I'm supposed to wear my fluoride trays for 10 minutes. And they ooze out, and that's also irritating my gums. So I think I'm going to try, since I don't like brushing my teeth on this side anyway, even the softest toothbrush is hurtful a little bit. I think I will try the Q-tip thing. So I'll let you know tomorrow if that works or not. We'll see. And then I'm looking at my list, because I went in there with a list. He gave me, I've got, I think I said last week that I felt like I was getting some mouth ulcers, and I do. None have opened or anything like that, so that's awesome. But I've got, some just inside, sorry, inside my lip, further down underneath my tongue. So he gave me a prescription for lidocaine hydrochloride oral topical solution, 2%. The pharmacist said put it in the fridge, it will taste better. So he said take a Q-tip, and at night instead of, I'm sorry. He said for my mouth ulcers to just dab this solution on top of it. And I don't know if it says how many times a day I can do that, but I will look. It says swish and spit. You can do it that way too, I guess. 1 teaspoon every 4 hours is needed for mouth sores, or apply topically, which is what I'm going to do with a Q-tip, to the irritated area. So every 4 hours. So I guess if my mouth were really, really full, I could just swish and spit. Now, for any ulcers and soreness down my throat, he gave me the Magic Mouthwash, which, again, both of these are Shakewell products, but this has the lidocaine in it as well. And I think I take a tablespoon and swish, but I swallow this. And it says to take it 10 minutes before meals, after meals, and at bedtime for mouth and throat pain. Again, the pharmacist said, put it in the fridge, it will taste better. So I can't wait. I'm not quite, I'm a little bit stubborn here. I'm not quite ready to do it, because I can put up with a little pain versus to experience bad taste in my mouth, because I'm such a picky person that way. And I think, well, and then I went for my radiation appointment, and I will tell you, day 11, I'm just saying that somehow I just don't always get fitted into the machine, well, with that face mask the same way. And see, I have lines on my stomach, I may have said, that helps them line me up, and they were lining me up according to the lines on my stomach. Um, but when the mask went on, it was instantly a very tight fit, and I was thinking, ugh, back to really, really tight. And it becomes tight, of course, on this side of my face, but I actually, I've said last week, it fit really tightly across this brow line as well. And interestingly enough, when I was getting dressed, I saw what I call the waffle marks on my shoulders. So that makes me feel like I just wasn't quite, but what can you do? So I left, and I had a lot of the waffling marks on my face today, and a lot more inflamed looking. That as I was going out and about in the afternoon, I suddenly realized that I really wanted to have a scarf, but I didn't. So I had my hair in a ponytail and just pulled it down. That's me probably being vain. But there is a point at which I'm sure if you're like me at all, you're thinking, at MD Anderson, when I go in for my treatments, I'm just one of everybody else. They're not all walking around with this particular issue, but we're all in it together there, for sure. But when you walk out into mainstream and you want to go in and buy some nail polish, for example, which I did, all of a sudden that became an issue to me today, because it's building. It's the radiation accumulates. So I felt a little uncomfortable, so I pulled my hair down from the ponytail, which I decided that funky hair was better than the view of my face. And I don't know if you can see, it's calmed down quite a bit, but it's swollen, and not totally noticeable at first. You guys may be able to see it. My cheek is more pronounced, and I had this raised area going up, and you can probably see that it's red. But we expect that, so that's okay. But I had planned to wear scarves, and today just kind of caught me off guard. So having longer hair, you ladies with me, we can kind of get by with putting it in front of our face a little bit. Anyway, not the biggest deal of the day, for sure, but just, how I'm feeling, what I'm thinking, and how all of a sudden today, after today's treatment, it was a little bit more than, before, and I felt a little bit more self-conscious about it. That's okay. So I just have, for my silver lining, I would say would be my son's tennis match. Although I didn't, of course, get to go watch it, I did get to have videos and pictures sent by my husband and my daughter, and they kept me up to date with how he was doing, and he won, and he did great, because I know it was probably a little bit nerve-wracking, your first match of the season. So getting that one under your belt, way to go, way to go. I'm proud of you. I'm proud of you anyway. You're already a winner, whether you win or lose, Walker. So, I guess that's it for now, and I'll see you in the funny papers.